Senior Medical Officer in the Ministry of Health, Dr. Francis Martin, with responsibility for the National Infectious Disease Control Unit, says the concerns listed in the Pancap report are relevant to Grenada, as they represent some of the same challenges faced by the ministry. According to the report, of great concern is that the annual number of new HIV cases among adults in the Caribbean declined by only 18% from 2010 to 2017, with key populations such as the LBGT community accounting for 68% of the new infections. Dr. Martin, however, adds that from a positive note, there has been a constant decrease in the number of new HIV cases in Grenada, with an increase in the testing services being offered. The report also called for an investigation into the steady decline in HIV-infected pregnant women receiving treatment from 2014 to 2017.
Fortunately for us, our maternal and child health program and our mother-to-child transmission of HIV has been an extremely low prevalence. In fact, we have had zero mother-to-child transmission for many years. In 2017, however, we had one case of mother-to-child transmission, and that was a case that we tried our best to see how we can avoid, but unfortunately, due to some social and other challenges, we were not able to avoid that one. But we are proud that the program is robust enough that we're going to continue to experience zero mother-to-child transmission going forward.
The senior medical officer, while admitting that there's concern with the decrease in global financial resources to support the HIV epidemic, says the ministry has begun to take steps to mitigate the lack of funding.
The truth is, yes, as international funding decreases, our ability to mount adequate response means that we will now have to look inwards and locally for funding going forward. Fiscal space within the health sector is always a challenge for everyone. We are trying to see how well we can do with the best that we have so far. But what I can say is that for the last few years, the international funding has been decreasing significantly. So really and truly, most of our local HIV program is funded locally. Our staff are being paid locally, or drug, antiretroviral drug treatments are being procured locally. Our promotion programs or screening programs all are done by local funding.
Dr. Martin also addresses the recommendations made by the Pancap Executive Board for countries to make amendments to laws in order to recognize the rights of key populations.
I think at the moment, our national HIV program recognizes that diseases and HIV spares no one. And so when we look at persons, we look at them based on their health status and their nutritional status. Now, as healthcare providers, we don't see people through lenses of sex or gender, or we don't see people through those lenses. Humans are humans, people are people, and we address them just like that. We recognize that there are some challenges in our society that would make it difficult for us to give all the adequate care that we need to give to key population.
He says they are continuing to partner with organizations to provide advocacy and awareness campaigns, as well as screening programs for people living with HIV and vulnerable groups to prevent the spread of HIV and AIDS. Joseph McKee-Smith, GBN News.